Now let's go over to Dan.
Well, funny you mentioned watery eyes, because actually today what we're going to talk about with Dr. Reed is dry eyes, treatment of dry eyes. Maybe you've seen that commercial with that model. She's doing that shoot. Have you seen that? And they're blowing sand in her eyes and they get all dry. It's not always as simple as just some drops, is it?
No, it's not, Dan. What you really have to do is figure out what the cause of the dry eye is. And there are multiple causes, and some of the medications that people take now have increased the incidence of dry eye problems. Antihistamines, antidepressants, some pain medications, some beta blockers. There's multiple medications that actually make your eyes dry. Besides which, for some reason there's an epidemic of dry eye occurring within the baby boom population in this country, and sometimes refractive or laser surgery will actually make the eyes a little drier as well for a certain short period of time after the laser surgery. So there's a lot of dry eye out there.
What's the problem if you have dry eye other than the discomfort? Can you do some long-term damage to the eye?
Well, you can. The long-term damage, probably not, but the level of discomfort, and particularly the level of visual disability, is significant. When light comes to the eye, the first thing it hits is not the eye, it hits the tear film. And if the tear film's clear and lustrous, people see well. And if the tear film's either oily or a little spotty or has a little mucus in it, which is some of the compensating mechanisms for dryness, they don't see as clearly. Their vision fluctuates. When they blink, it gets better, it gets worse. And so it's not just a level of irritation that bothers them, but the level of visual acuity and how clearly they see can be affected significantly by the amount of tear film they have.
So if you're suffering from dry eyes, you make an appointment with the ophthalmologist, you go in, the first thing you do is run down any medications they might be taking?
Yes, you go through all the medications people are taking, you go through all the environmental exposure they might have. For example, sometimes people do fine except if they sleep with a ceiling fan on at night. During REM sleep, when their eye opens up a little bit, the circulating air dries out the cornea a little bit. They wake up in the morning. Their eye feels gritty when they first open it. That lasts for an hour and a half, during which time they tear a lot. On the way to work, they're having trouble seeing, driving, and so forth. So there's all kinds of environmental causes as well as medication causes. So you go through all that to begin with, and then you evaluate through a number of exam techniques to see what the actual underlying problem is. Sometimes it's the lack of oily tears. Sometimes it's lack of watery tears. Sometimes, like the sweet lady who just had the makeover, it looks like they have more tears than they need. It's actually a compensating mechanism of overflow.
What are we looking at here, Doctor?
A couple of graphics of some staining on the front of people's corneas. That little strip stuck in that fellow's eye down below there is a way you measure how much tear function there is over a 5-minute period. The little greenish dots on the surface indicate there's some dryness there, and that's one of the tests we use when people come in for an eye examination. Again, this is a different type of stain, the green on the right. On the left, kind of a reddish stain, rose bengal, which actually shows that in this particular patient down below, they have a tremendous amount of dryness and irritation, which stains with that reddish stain.
So you determine the medications, the environment, and then you come up with a treatment, drops or something more extreme? Drops
work easily. They're the easiest way to go if you can get away with that, but most people that's not sufficient. So one of the other things you can do is keep the tear film that people make in longer. One of the misconceptions is the little hole on the lower lid is actually where the tears come out. It's not. That's the downspout. You block it off, the tear film backs up. The good Lord provided for it so that it doesn't overflow. There's an overflow on the upper lid. So the tear pool deepens, the plugs work well. And some medications now, including this one, Restasis, that Allergan makes, actually helps to restore a normal tear film, one of the few medications that's ever been able to do that.
Do you need a prescription for that?
Unfortunately, you do.
Okay, well, you can get more information.